With the unknown impact of changing legislation and reimbursement here in the United States, I've made the argument that it is critical that occupational therapy professionals consider a side hustle private practice to diversify their income streams. While many therapists dream of a private practice, the risk of hitting a legal landmine holds many of us back. So in this episode, we are going to zoom in on one OT who is looking to partner with a doctor who is providing concierge dementia services. We'll use her startup as a case example to talk through what legal considerations OTs need to make when starting a practice. We'll cover choosing the right legal entity, navigating Medicare, and just understanding your practice act. Yes, we are going to get into the weeds in this episode, but I just believe this is such essential information, both for practice owners and just everyday OTs. I also want to let you know that we get so deep into the weeds that we are going to do a second episode in the upcoming months to cover contracting and antitrust and anti-kickback legislation. We have a lot to cover today, so let's dive in. Welcome to the OT Potential Podcast, where we help inform and inspire OT professionals. Welcome to the podcast. I'm your regular host, Sarah Lyon, OTRL. Today, though, we are going to turn this conversation fully over to our two guests, Monika Lukasiewicz, OTRL, who is looking to start a private practice, and Alyson Stover, MOT-JD, OTRL, BCP. Alyson is a pediatric occupational therapist and private practice owner who also has a degree in health law. Before I patch Alyson and Monika into this podcast, I'm just going to give you a brief bio on them so you can kind of get oriented to each of them and what they bring to this conversation. Monika works as a professional problem solver, inspired to explore and bring more practical, person-centered solution to dementia care and resilient aging, especially through collaborative, family-centered offerings. She has always loved problem solving, writing, and helping people expand into their own version of a more meaningful life. She has been inspired by trainings as a dementia-capable care specialist and trainer through the Crisis Prevention Institute and in the use of COPE, the Care of Older People in Their Environment program through Drexel University. Monika earned her Master's of Occupational Therapy from the College of St. Mary in Omaha, Nebraska in 2009. Since then, she has worked in acute care, acute rehab, ICU, skilled nursing, outpatient, as an adjunct professor, home health therapist, writer, podcast developer, and coach. So like I said, Monika is looking to start this private practice, and she is going to be in dialogue with Alyson Stover. Alyson and her husband own a private outpatient pediatric practice in a rural county in Pennsylvania and co-founded a nonprofit organization that uses occupation to address community, societal, and population needs. She currently serves as the director of clinical services and continues to practice as an occupational therapist at Capable Kids and lead clinical consultant for Capable Families. Alyson's areas of expertise include pediatrics and holistic occupation-centric approaches to substance misuse and trauma. Additionally, she consults in various capacities, including clinical as well as systems, bringing expert program development knowledge and change at the micro, meso, and macro levels, sustainability, and business resilience/staff wellness. Additionally, Alyson is an associate professor in the Department of Occupational Therapy at the University of Pittsburgh, where she also obtained her Juris Doctorate in law with a postgraduate certificate in health law. At the recording of this podcast, Alyson was also serving her last day as the president of the American Occupational Therapy Association, but by release will be our past president of the AOTA. So without further ado, I am going to patch Monika and Alyson into this podcast so they can take over the conversation on legal considerations for your OT practice.
Welcome, Monika. I am so excited to have the chance to use your business ideas as a case study for us to discuss all kinds of legal considerations for the OT entrepreneur. So to begin, why don't you just kick us off? Tell us a little bit about the story of your business idea and where you are with it now.
I'd be happy to. And thank you for the opportunity to get to be here and come to this conversation. So, a little bit of a backstory of kind of the context of what brings me here today is I have the experience of being an occupational therapist for the last about 15 years, and I've worked in a variety of frontline, kind of in the trench experiences. And more recently, I've really come to the clarity of, there's a desire to serve families, particularly families who are living with dementia, who have an interest in staying at home. But some of the complexities of the background that lead me to like an intersection that I'd really love to unpack with you, and that I sense other occupational therapists really have like healthy tension around as well, is this understanding, if let's say I'm interested in exploring ways that I can deliver occupational therapy or use my skill set as an occupational therapist to serve these families living with dementia with evidence-based approaches. How do I do that in such a way that I'm being mindful of these payment models that need appropriate respect, particularly Medicare? How do I do it in ways that if I especially am coming from, I'm a single income household as well. So if I'm looking at being an entrepreneur, looking at that detail, as well as this win-win pricing model that I think is sometimes really easy to want to overlook, because I know in school so many of us haven't necessarily thought of like the real price tag on ourselves. But in order to be around to keep serving families, how do we bring together a pricing model that matches for everyone as well as sustainability? So really, in kind of making a long story short of the business model that I'm looking at, it's how to bring the best, especially evidence-based approaches of dementia care, the best of occupational therapy, into really being able to serve families living with dementia, as well as, exploring the option of having things like books as well. And so that's kind of, if I had to say, long story short, that's the idea I love to explore with you.
Yes. And Monika, I love this idea of hearing you talk about too. You want to get to a place of serving families. And where I am in pediatrics, that's a common phrase, right? But when we think about adults, older adults, individuals experiencing dementia, that's so rarely a phrase that we hear anymore, which I think is just clear evidence that your business and your business model and plan is so necessary, and why us in this occupational therapy profession need to understand these nuances, because that's exactly the kind of uniqueness that we're bringing to the fold. So I love hearing about this. I also love hearing that we should dive in deeper and have these open conversations about what pricing models really look like, because we do need to value ourselves and represent that value in a way that says, I can do this and be a single income home. So I am very excited to dive in. So let's start off by talking a little bit about the type of legal entity that you want to consider. So do you have an idea already? Are there a few options that you're working through?
Great question. So I'm looking mostly at LLC to start. So I'll keep throwing out just like background context for the listener who may kind of be curious of like how far along I am. So at this point, I've looked online at like different business names that have availability as websites. I have not yet officially kind of like closed the deal yet, but I'm looking at LLC to start. And then because of how much time there is left in the year, because it's technically end of June right now, I'm looking at the potential of going S Corp later, but currently just like starting in an LLC. Happy to have any of your thoughts that kind of come to mind when I say that.
Yeah, absolutely. So, one of the things that we know is that LLCs are the most utilized by the broadest range of entrepreneurs that are starting their own practices, businesses, and the like. So, these are fairly simple to form. They have flexible business structures. They're generally formed with your state, and you have a simple articles of organization. We also have something that's similar to, but a little bit different than the LLC, and that's the PLLC. And this is really an LLC for licensed professionals, and we see it frequently used in the legal field with attorneys. And then it started to really branch out, and we can see it with a number of physicians, but it's not often utilized by occupational therapy practitioners. However, it's a great option. It's the same as the LLC, but it does require that you have a licensing requirement that ensures that this idea that you are a licensed professional. And so with that, we really start to see the idea of bridging towards a marketing space, right? And thinking about that idea of what's the LLC versus the PLLC, and what kind of uniqueness might that bring to your brand that you're setting forward. So you also talked about an S Corp. And with the S Corp, it's really the idea of being able to sort of package together the tax benefits of an LLC with the other business operational elements of a corporation. And so it is formed as a corporation, but it's elected as an S Corp status. And so when we think about that, right, the LLC or the PLLC, the ownership is fully in that idea of members, and it's unlimited. So it generally starts with ownership as just one person who's starting the business, like yourself. You may find some individuals that might be silent investors or even just investors in that space. And so, again, thinking about that idea that your ownership is limitless. You can have an unlimited number of members that have ownership in your LLC or PLLC. In an S Corp, they're not called members, they're shareholders, and we're currently limited to no more than 100 at this point. And then thinking through that idea of like, well, what are some of those, maybe tax benefits? And what we know is that in an LLC or a PLLC, the taxation is really going to pass through to members. Whereas in the S Corp, it's going to pass through to the shareholders. So that means that the members in an LLC or PLLC will pay a self-employment tax on the full income. Now, an S Corp, only the salary that is paid is subject to the self-employment tax. And so anything that they would consider dividends or not. So thinking about that, again, your LLC, your PLLC, you're sort of paying the taxes on all of the income versus that S Corp, you're only paying it on the salary element. And S Corps and LLCs and PLLCs are all incredible in that they shield your personal assets. So they provide this incredible layer of protection that says that while the business entity can have liability in lawsuit, your personal assets cannot. So they can't take your home, your car, that type of thing, which is really, really great and meaningful.
100%.
So really, when we think about that, some of those like key takeaways, right, are that the LLC is simple. It's incredibly flexible, and it is the most ideal for that startup business or a business that's smaller. You're going to have less paperwork, more control. Moving into that PLLC, again, this is going to be simple, flexible, but it is going to be only for the licensed professional. And because of that, really does establish your business entity as something different than an LLC. There are some states that make it a legal requirement for anyone who will be practicing healthcare to file as a PLLC versus an LLC. So I would encourage you to take a look at the state that you're filing in and making sure that a PLLC is not a requirement if you're going to practice healthcare.
So can I ask you a quick question on that?
Yeah.
And this may kind of funnel into some things that we'll talk about even later, but when I'm so glad you mentioned the PLLC. Really did not realize that existed. And it sounds like from what you're saying, a PLLC from a marketing standpoint, it lets somebody know like, oh, I'm not just working, and not, I don't mean to say just, but like this is a licensed professional who is the owner of this business. That being said, am I accurate in kind of my summary thus far?
Yeah, so one of the things that the PLLC does, right, is it tells the community
Yeah.
that you are a licensed
Yeah.
professional, that there are requirements in order to do or practice how you are practicing your business that are actually sanctioned and reviewed by the state licensure board, right? An LLC doesn't necessarily say you're not that. It just simply doesn't share.
100%. I love that. So, because I can imagine that there may be some listeners, and what you say to this will also relate to me, where there may be the question of somebody who's like, well, yes, I am licensed as an OT, and in this business, I'm either going to be writing books or I'm going to be coaching. And it's not under a traditional umbrella of OT. In that particular category, I think I'm under the impression that the PLLC is still relevant if indeed the person who owns the business and who is creating the content is operating under a professional license, whether it's directly related to services or not.
Exactly. And so you should have at least one service that is provided under your PLLC that is directly related to the license that you are relying on for that, right? But in essence, think about it. Like, so writing a book, right? Are you going to write the book and incorporate really the occupational therapy process, the evidence that supports the work that we do in occupational therapy? Is it going to provide information that really is, in a sense, a delivery broadly of occupational therapy? Sure, it is, right? And so, yes, that's a PLLC. Are you an individual who is saying that the coaching that I bring to the table is coaching that is done through the lens of my occupational therapy training? That's, yeah, you are, right? Are you delivering the direct services? No, but in our scope of practice, is there a world in which the consultation that utilizes your OT lens is the delivery of an OT service? It is. Can someone deliver your style of coaching if they are not a licensed occupational therapist? Probably not, right? Like there's certain things that you may be incorporating into your practice that is utilizing the very foundations of occupational therapy. Are you utilizing a model of COPM or the occupational profile? Well, if you are, then in essence, there's not an individual who is not a licensed occupational therapy professional that could do that, right?
Yeah. Yeah.
And so, and then thinking about it along the way of maybe there are some direct interventions that you would like to provide, that you want to bill traditional reimbursement sources for, right? Well,
Yeah.
how great to be the PLLC, right? And this is stating that you are, as the owner, recognized as a professionally licensed individual.
So you bring up another fantastic intersection, I feel like, of healthy tension, at least as it pertains to like my own experience. So I'll lay out some context because I know OTs love context, and I think it's so helpful in just kind of framing the whole situation. So a couple of the experiences that I have had in regards to doing evidence-based work in dementia care, and part of what inspires me to explore innovation in new ways is really this understanding of the quality care that goes into evidence-based models, which is coming from the skilled side, a tremendous amount of respect, and I almost want to say like humble respect for the person living with dementia and their village, and what they're experiencing and what they're navigating in regards to the condition itself, paying for different services, insurance, whether it's going to cover or not, and under whose insurance it would even go under to be covered. Because so many times in addressing the needs of the person living with dementia, the sustainability of that is including the person with dementia, but ultimately we're addressing the family, like so many pediatric things. So I love that you pointed out the overlap of that too. All this being said, one of the experiences that I've had is there's the tremendous value that comes through in a very traditional occupational therapy evaluation that is seeped in evidence-based practices. I think especially like Skills to Care, the COPE program through Drexel, and programs like this. So there's this element of like, a family kind of comes through the funnel of service, if you will, with this traditional experience of an evidence-based approach in the OT assessment, as like to give now this like another angle for context, as the skilled clinician coming to that particular experience, who is has experience in the field, has gone through extra trainings, has gone through mentorships, the tremendous tension point that eventually leads to where I'll like end this context is in the intersection of where these services and how these services are paid for. And so where I'm going with this is that there is, in this particular kind of example, there's this family, and we'll assume that the person living with a form of dementia is 70, right? So they've got Medicare. And me as a provider, let's say that I am an experienced provider. I'm hungry to learn. I love growth, and I also love the opportunity to grow financially. And I think this is something that as occupational therapists, that sometimes there's almost like a shame in saying that. Like, I want to do really good work, and I'd like to grow professionally and financially in my career. So where I'm going with this is that if I'm at that intersection and I'm a clinician delivering these services to this family who's Medicare, they've got Medicare coverage, traditionally I'm capped as a provider by, by the prices that have already been set through the procedure codes, the CPT codes of these specific services that I'm giving to this family. And I have a respect for the fact that whether it's a nonprofit or for-profit that is working with a therapist delivering these CPT codes, Medicare is it's not set up for, nor I think is it really watching out for how do we keep good, skilled clinicians in Medicare-based work. So all this being said, a big tension point is how, especially in the business model that I'm exploring, how do I, with this tremendous amount of both humility and honesty, recognize that part of the tension of wanting to serve these families and bring this tremendous value that all of us have already experienced be sustainable given this Medicare model, but given the fact that if we go to any solopreneur and say, hey, how is your business doing on its Medicare-based reimbursement as an entrepreneur, I think we'd pretty confidently say it's not a good business model for an entrepreneur, at least how I'm thinking through it. And I think how most people think through it traditionally. So will you help me unpack new angles to see, especially from the business side, the value is unmistakable as OTs, just like quickly highlighting, being able to look at the environment, being able to look at and take into consideration the care partner, the family, being family-centered, as well as taking into consideration, most importantly, the functional capacities of the person who's living with dementia, and being able to eval all those things in one space is so phenomenal. And so the value that can be created, not just from the eval itself, but from the interventions that can follow. So values established, but where my heart hurts is how to take that value, how to put on a bit of a business person hat and try to explore, is there anything here innovatively that we can do? So that was a lot. So thanks for
No, no. And thanks for walking through your own journey with this, because I think sometimes we also have this idea that, like, we're having this journey and this experience and this pull between, I desperately want to serve the community, the population that drives my own passion for the work that I do, right? But then at the same time, I also do need to be able to pay my bills. And it's okay to want to take a vacation and be able to afford to go somewhere when I'm on that vacation. And so I really appreciate you being willing to share that journey out loud, because not only do we have it as occupational therapy professionals, but on top of that, we rarely share it out loud. And so
And
there's,
also,
go,
I just
please.
I just want to say I really appreciate you saying that too, because I think that is also why so many really great clinicians, and not, I know this is not across the board, but sometimes feel like you have to go non-clinical. So sometimes it's like, is there any, if I can't grow, then I might as well go non-clinical, but I love being clinical. So I appreciate the way that you just like summarize that. Thank you.
Yes, absolutely. And so, what I want to just first express is the idea that occupational therapy does not only have relevance in the medical model as it exists currently under traditional payers, right? I mean, think about the idea that when you are designing a space, and we see many individuals, Francisco Lasta comes to mind, does incredible work in designing spaces, right? And he says, I'm using my occupational therapy skills in order to do that. What I think we have grown too accustomed to is not being able to see the difference between what our licensure laws tell us we are permitted to do in terms of practice, and what traditional payer sources say must occur in order to be reimbursed for our practice. So, with that piece, let me first start out by saying this idea of alternative revenue streams doesn't necessarily mean, do I have to go into a non-clinical space? Do I have to consider how to build or brand or endorse a product, right, that's different than service delivery? What it can really look like is, where are the spaces that my licensure law prohibits me from practicing occupational therapy? And then if I eliminate those areas, what is it that I can do in practicing occupational therapy outside of the medical model? So, for instance, let me give you an example. You could absolutely be a solopreneur who has your private practice, and you are working with individuals that have dementia, or the families that are experiencing dementia. And you can be delivering traditional occupational therapy best practice services. You can be billing Medicare for the services that you are providing. But then you can also have another line of business that isn't direct one-on-one or traditional occupational therapy that is billed and reimbursed through Medicare. So I'm thinking about the idea of potentially how you could engage and interact with environmental design, or really like the city planners and architects. And you can say that you are delivering occupational therapy services. When you evaluate an environment and think about how you can increase its accessibility based on who needs to use that environment, what they need to do when they're using that environment, and where limitations and barriers may exist, as well as how to optimize facilitators, you're doing occupational therapy, right? What's the difference between saying I'm doing occupational therapy when I put grab bars into an individual's bathroom or home, versus the idea of saying, feeling like you're not doing occupational therapy when you put grab bars into a public restaurant. We forget that our practice framework says that communities, populations, businesses can all be our patients. So thinking about that, maybe there is something that you want to do. Maybe you design. I know that years ago when I had first begun in practice, we were still permitted to have populations and groups as patients. And so I was working at that point with a lot of different corporations applying occupational therapy to develop what their workout spaces needed to look like.
Uh,
So at that point, we had had some changes in some of the requirements of private health insurance, and they were in this mode of embracing prevention. And they said, if you provide a space in which your employees can get movement, exercise, workout, right, we can offer a reduction in those monthly premiums. Well, so then I would say, as an occupational therapist, I do know how to design a space. I can tell you the equipment to purchase, but the equipment that I'm going to tell you to purchase is the same equipment that will challenge your new 27-year-old employee who's preparing for the next marathon, as well as your employee that you love and has been there for 45 years and is approaching 70 years old and has some difficulty with movement related to arthritis in their hips and knees. I can actually show you how to use the same piece of equipment. And the reason that I can is because of activity analysis and the ability to grade participation. And that's occupational therapy, right? And so I am delivering occupational therapy to a population, a group, in a way to enhance or prevent further injury, illness. And I charged a lot for that, right? Because that was a high level skill. And so recognizing that occupational therapy is something that we are able to deliver that doesn't just have to be delivered under what Medicare reimburses or even what private insurance reimburses, right? And so when you look to your licensure law, is there something that prohibits you from practicing occupational therapy in a certain space or in a certain way? Or do you require something in order to be able to practice or deliver occupational therapy services? And with that, you then think about what is it that I am providing, and you start to look at some of the services that might be delivering a similar product, and what are they charging? And what is it that is required or unique that you're bringing to the table? And when you think about that, what kind of time are you putting into it? Are you traveling to get to spaces? Are you engaging in conversation with other individuals? What all is involved in that practice that you're delivering? Another thing that we used to do when I first started was I lived in an area where private schools were very sought after. And actually, the competition to get into the right private schools, starting at kindergarten or first grade, it felt almost more than what it took for me to get into college, right? And so with that, there were parents who were seeking out individuals who were able to give developmental evaluations that actually stated that their child had advanced developmental skills, right? This is not something that insurance wants to pay me for. They don't want to pay me to determine where a child is advanced in their skills, right? And this kind of fell outside of that scope of why the physician wanted to refer to me to begin with, right? Like this idea of referring to have an evaluation for a child who's demonstrating strengths, that seems unheard of in our medical model, right?
yeah.
But when when we looked and saw that the licensure law did not state that it required us to have a prescription from a physician in order to deliver services, right? We then were able to provide those services, provide an occupational therapy evaluation, to then deliver what was the evaluative report, and do that at a cost that said, this is what it took for us to get there. And so I say that in filter two, when you're thinking about those other lines of service that you want to deliver, what does your licensure law say that you need in order to be able to call it occupational therapy, in order to be allowed? Don't look at what the traditional medical model systems tell us that must be present in order for it to be occupational therapy. And so from there, start to think about, what is it that I can deliver? Do I need to call it consulting? Do I need to call it coaching? Can I call it occupational therapy? And if you can, think about how that feeds into a marketing plan, right? Where you may be describing and reaching out to shared consumers in a coaching world. But can you call it occupational therapy? Is that permissible? And if it is permissible, what does that mean in regards to how you would market what your service is, maybe above and beyond your competitors?
These are really great questions that make me think of this, both diversified model, like you've talked about, so that it's like, yes, there's always the option for like the traditional clients, if you will, as well as thinking outside the box for how that could be of service to those clients, but perhaps in a broader scope. The thing that it does make me think about next, or kind of like, if I were to take in more of the information you just mentioned and kind of start playing with it on a practical level, it makes me wonder, I guess it brings me back full circle. And so I'm grateful to get some like outsiders input on this, because I'm so close to it and I'm so used to kind of these main tension points. But I feel like it brings me back when I try to think of other ways to bring value, especially to that frontline experience of the family who's either living in town or perhaps out of town, but is really trying to serve that person who's living with dementia. And to me, it's like where sometimes I feel like I get stuck in a business model is being in this mindset that like one of the most truly valuable things to kick things off is that OT assessment. And is there any way, like before even asking any other questions, is there any other way to frame the OT assessment without it having to be billed under the Medicare model of OT assessment? And I'll go one step further and say, part of what frustrates me about tagging it that way is that the value, and let's just say, I want to say it's around $150, whether it's low, moderate, or high complexity. That's the rate Medicare is saying we're going to give you for this eval, not including paperwork, not including all these other things like that you just mentioned that go into this. So from the get-go, I know that the value it's devalued, and perhaps that's too strong of a way to say it, but the gap in funds for the value that's being delivered for that OT isn't there. So where I'm struggling is like, how do I even start? Let's say if I just start even with this particular experience that I want to try to give families through that assessment OT piece, how do I take some of the things you've even just mentioned and try to bring those things in for still serving at this like touch point in the community while still being like a business person? Because I feel like if that was what I wanted to try, if that's where I wanted to try to bring value, I haven't yet been able to find a way to bring value to that touch point without being like, that's a bad business idea, and not wanting to pursue bad business ideas. Does that make sense?
So if I'm hearing you correctly, the first part of the question is this idea of how can I provide like an occupational therapy evaluation with maybe not having not calling it an occupational therapy evaluation in the sense that it would be recognized by Medicare as what they deem the reimbursable service.
Yes and no, and like this is this is exactly the tension point. Because I feel like the things and in some, for further context, and some conversations I've had with folks of trying to unpack this, right? To be like, the value that I want to give families is so much of the value that I do give families in Medicare-based work. However, the model as a clinician who's experienced and hungry for growth, for me to stay available for those type of deliveries is a challenging place to stay because of the very low reimbursement model of that. And so it's like, is there any way to create more of a win-win experience there without feeling like ethically so challenged to be like, I don't want to, yeah. Does that, does that clarify a little bit?
Yeah, so I think it's, I think we have a variety of factors to look at. And I think this is where we can also really start to consider, we can really start to consider things like those alternate revenue streams, right? And the number of things come to mind as you're talking. One is, let's talk about some of the biggest barriers to those of us working with individuals who are 65 and older, and that's the fact that occupational therapy still cannot opt out as a Medicare service, right? And so in the just very most basic sense, what that means is, regardless if you become an approved Medicare provider or not, you cannot provide a service that Medicare covers to an individual 65 and older without billing Medicare, right? And so at a very basic example, you might have an evaluation for an individual with dementia that is still living at home, right? And they are, let's say, 77 years old. And you run a cash-based business only, meaning you don't bill Medicare or even private insurance. You cannot provide that occupational therapy evaluation to the individual because even though you are not billing Medicare, you are not an approved provider under Medicare, it is still a service that Medicare covers, and therefore that individual cannot access it from someone with a private pay model. It's always interesting to me. There's a difference between being an approved provider for Medicare, which you have to apply for, right? And having the ability to opt out as a Medicare provider. Just because I cannot opt out doesn't make me an approved provider for Medicare. Doesn't mean I necessarily can bill Medicare. It just means that I cannot provide services that Medicare covers to an individual who would be able or eligible to receive Medicare coverage at a cash-based price or by not billing Medicare. So when I look at this, though, there's a number of things to consider. One is that Medicare does have exceptions. And so is this an individual that you may want to look into the Medicare waivers that exist in which that client could sign that waiver? We know that we cannot have a practice in which we see all Medicare aged patients at cash-based, and 100% of them are signing those waivers. So that can still be limiting sometimes. The other part of it is, who is your client too, right? So thinking about who your client is another space where you might want to consider, what's the service I'm providing and who really is the client? When you think about the idea of, and you entered this conversation saying, I want to service the families of individuals who are experiencing dementia. I think about right now my own father who has dementia, right? And I think about the number of things that we are doing and working with as his family members to ensure that he's at home, safe, and doing the things he needs to do, wants to do, and is expected to do, right? That we're finding ways to minimize the rate of progression of his dementia and minimize experiences of frustration, right?
Yep.
The fact is at this point in his dementia journey, we've already discussed with the physicians, there's not a new learning that's going to happen. He's not going to learn the new way. So who is the individual who is understanding and developing the potential red, yellow, green, right? Technique that we are going to utilize on things like the stove versus like the microwave versus like opening a drawer, right? So the drawer where his underwear is, we have a green light because there's never a time he can't open it. He can open it whenever he wants. The red light says stop, and he must ask my mom to help guide him through that process, right? Well, really, it's me. I'm not intervening I'm not like the intervention. Yeah, it's to keep him safe, but I'm the one changing my habit, my routine. And I'm not 65. And so is there an opportunity to do that evaluation that does my environment encompass my father with dementia? Yeah. But am I the one that needs to change my home environment? Yes. And so who is the patient? Who are you delivering the intervention to? Who is performing the intervention? And that can help us as well. So you might even think about that idea of, now I'm the patient. I'm the one who's got to change things based on my environment that now includes a dad with dementia. And I am not 65, and therefore I'm not eligible to receive your services under Medicare. And so you can bill me private pay out of pocket. You could also talk to me about the idea of, I have private insurance. Perhaps my PCP, who's been seeing me and annually and has now put me on blood pressure medication, and we talk regularly about the increase in my stress experience. Now I can talk to my PCP and say, there's an occupational therapist who is willing to evaluate, assess my environment, how I talk to my dad, and engage in the multitude of things that I need to do with him that we know are all the things that are increasing my stress. Would you be able to help me to get a prescription for that occupational therapy assessment? And maybe we can even look at reducing my blood pressure meds after that, right? You may have the opportunity to bill those services under my private insurance because I'm the patient, right?
So can I unpack that a little bit?
Mm-hmm.
I love this idea. And so there's kind of two different layers to this. That first idea of really having the care partner be the client is one that I love. And it brings me to a bit of a tension point, because now with the new caregiver training codes, that's where I perhaps need more conversation and just have to keep digging a little bit deeper into this, because my current understanding, and this is where I'm also, curious of like where these can be differentiated out, like if the referral comes or if the interest comes because you come, on your own and seek the services that I can offer to you as the care partner, which does include me assessing your dad, but for you, not for, I'm not delivering that back to him. I'm delivering that to you. Those services, if you hadn't come to me directly as the care partner, those same services are billable currently under his Medicare insurance if they're sought through medical necessity on his end. So can you help me unpack that perhaps a little bit? Because that's where I'm like, shoot, could I do that?
Yeah. So what you want to do is, if you are looking at the ability to bill, right, you want to look at what the codes would specifically say and ensure that when delivering those codes, that your client is the central point of assessment, right? So think of it in regards to how you might do perhaps a work hardening assessment. There are a number of jobs that require us to engage and interact with others and be aware of the safety of others. And so I need to be able to evaluate the difference between the requirements of students in a preschool, traditional, private pay classroom versus the needs and the requirements of engaging the students in a high need, maybe specialized program for children with multiple disabilities and complex medical conditions, right?
Yeah.
I actually have to see and assess how those children are performing and what they require in order to be safe, in order to say, this is what you need to safely return to that job, right?
Yes.
So if I have someone who is injured, you need to be able to keep children safe in both spaces. This is what it requires in this environment, and this is what it requires in that environment. Likewise, if I need to provide care to another individual, sometimes you have to assess that other individual to determine what level of care is needed, to then be able to determine if I have the cognitive, physical, social, developmental skills to do those very things, right? So thinking about that, you want to think about things like your assessment and your interventions. You're not just educating, right? You're delivering a direct service. When you do that evaluation, it might be really meaningful to think about how you determine where the executive functioning, strength, and endurance is of that caregiver, right? Because that's then also going to determine what type of meaningful different interventions you might do, which actually might then say, wow, we've got to think about how to have you at a better state of sleep. We've got to work on sleep hygiene and routine for you, because your own fatigue and endurance is impairing your ability to provide the type of safe environment for your loved one and yourself.
Okay, so this is I've got a question, because this is sparking some brand new ideas. So this is incredibly helpful. So curiosity question wise, I'm wondering what you may suggest if, in speaking about the client, and I know there's some things to talk about even in regards to referrals, but in thinking about the client and in how we're really defining the client, a question that I have, and maybe this is for another podcast, but is, if I were to make the community my client, if I were to make, a business the client, how would I need to begin thinking differently about that from the beginning as an OT? Because I think there really could be room, if the family's the client, are there ways to begin bringing this as an opportunity And again, maybe that's too big of a rabbit hole to get into today.
No, so I mean, I think this is exactly, some of the conversation that you were thinking about even too, at this idea of like physician referrals and documentation, right? So one of the first things that you need to do is recognize or understand what your licensure law says. Do you require a physician referral in order to practice occupational therapy? So once you check on that, and there's a number of states where their licensure laws say no.
You don't have to. Yep. And in
You
Arizona.
don't have to.
Yep.
And so, and there's a number of states in which there's some qualifying indicators as to when it is needed. And then there's some states that actually name who the referring individual could be. And all of that can have an effect on what you're saying right now, right? On identifying whom the client is. Anything from an individual all the way through to like a family structure, or particularly maybe even a group or an entity. So definitely first thing you want to do is check in your state licensure laws and see what that requires. And then we want to move on to documentation. So what are the things that you need to include in your occupational therapy assessment? Are you evaluating or assessing the environment, and what tools are you utilizing to do that? Are you taking a look at roles, habits, routines? Are you engaging in collecting the information of an occupational profile, right? And when we look through that, there's a number of ways that we can do this. Maybe it's requiring that you do a roles assessment to every individual in the family. Perhaps you need to understand the facilitators and the barriers to the consumer or the individual that's utilizing a business. Maybe you need to evaluate what level of executive functioning is required in order to engage in that space or to do the work that you're evaluating or assessing for. So once you find what that licensure law prohibits you from doing or allows you to do, then you define your client. And after defining your client, you start to look for, what is it that I need to have knowledge on? Where are the areas that I need to assess? And what tools already exist in order for me to build those into my full evaluation?
So just as a clarifying question, because I know we've talked about a lot. So if, let's say hypothetically, I've got the PLLC, I just want to clarify if I could do both traditional OT as well as coaching underneath that one PLLC.
Yeah, it's a great question. And I'm going to give a very legal answer. It depends. So it's going to depend on your state. Some states require that under a PLLC, a certain portion of your service options must be those that can only be performed by the licensed professional. Some say that anything can happen as long as it is activities that are supportive of the services that only a licensed professional can perform. So it depends, but it's pretty easy information to find, and there are a number of resources within your state, your Chamber of Commerce, some of the different departments within your state government always have information and are willing to answer those questions. So take a look and see what your state requires, but there are opportunities to offer both.
Okay, love that. And then you also mentioned the word like supportive things. And so when I think of that, what comes to mind also is products, and whether or not there are certain things I need to be mindful of if I'm recommending a product, but it's a product I have also created. Can you speak to that a little bit?
Yes, so this is a great question, and I think we can touch on it a little bit, but this is a comeback for part 2 of our conversation, because this starts to bridge us into the world of antitrust, where we look at things like anti-kickback law, Stark law, even monopolization, and monopolies occur in this world. And it's particularly relevant to healthcare practitioners. There are some instances when you certainly can design and be owner of a product in which you sell at the same company or business in which you own and operate to deliver services. A lot of it has to do with the relationship of requirement. Do I, as an individual receiving services from your facility, require purchase of your product in order to receive those services? That's usually a pretty big red flag that's going to trigger a number of antitrust laws. But there's a lot of different ways in which this is allowable by law. And so you really want to think about if this is something that you're doing. I would encourage you to tune into our part 2 of this conversation, but also I would say it's absolutely necessary for you to start to investigate what antitrust looks like in your area and really engage with a professional who can give you some guidance and lead you on that journey of determining what is right.
Appreciate you so much. Thank you for this conversation. I look forward to part 2. This has been incredibly valuable.
Monika, I can't express my excitement enough. I love that you're willing to think outside of the box and go on this conversational journey with me. There are so many ways that occupational therapy, we can be entrepreneurs. We can have successful businesses that support a one-income household and allow you to take that incredible vacation, or in my instance, buy those heels that you've been eyeing up forever. We don't need to fear it. We don't need to think that there are too many barriers. We just need to be willing to have the conversations out loud together and know where to find the resources. So thank you for opening the door, for being open-minded, and for getting us all ready for part 2, where we explore a little bit more about that very, very interesting job and business that you want to pursue.
Thank you so much.
Thank you.
Wow, you all, there is so much to take away from this conversation. I hope you feel emboldened to start your own practice, but also challenged to explore that right business model for you in your particular state under your particular legislative umbrella. I personally feel a charge to create more resources to help you in this process. We already have a foundational post on OT Potential on starting your OT practice, but with this episode, we will also be launching a post on CPT codes so you can really understand reimbursement under Medicare even more fully. This reimbursement really drives OT delivery for older adults in the United States. We will also be working on an OT license post that will help you find your particular practice act to understand occupational therapy in your state. We will also be recording a part 2 of this conversation. So as always, please comment in the club with whatever further questions you may have or resources you would like for me to create. The OT Potential Club is also where you will go to earn a CEU certificate for your time today. So what you are going to do next is head to otpotential.com and either sign in or sign up for the OT Potential Club. Once you are in there, you can take a 5-question test, and when you pass, we will generate a certificate for your time today. Okay, I just want to thank you so much for joining us. I hope this podcast helps keep you informed and inspired as an OT professional. Take care, and we'll talk next time.